1. Which of the following is the primary role of a certified medical technician, CMT? A. Diagnose and treat patient illnesses. B. Administer medications under supervision. C. Perform surgical procedures independently. D. Prescribe controlled substances. 2. Before administering medication, what is the most important first step? A. Checking the expiration date. B. Washing hands. C. Verifying the medication order. D. Asking the patient if they want the medication. 3. The 5 rights of medication administration include all except A. Right dose. B. Right patient. C. Right diagnosis. D. Right time. 4. A CMT observes that a medication tablet has fallen on the floor. What should be done? A. Pick it up and give it to the patient. B. Discard the medication properly and document. C. Rinse it with sterile water before giving. D. Place it back in the medication cup. 5. Which type of medication is absorbed the fastest into the bloodstream? A. Oral tablet. B. Transdermal patch. C. Intramuscular injection. D. Intravenous injection. 6. A CMT is preparing a liquid medication. Which tool ensures the most accurate measurement? A. Household teaspoon. B. Oral syringe. C. Coffee spoon. D. Plastic cup without markings. 7. Which government agency regulates medication safety in the United States? A. OSHA. B. FDA. C. CDC. D. DEA. 8. When administering eye drops, where should the CMT place the medication? A. Directly on the cornea. B. In the lower conjunctival sac. C. Inside the upper eyelid. D. On the eyelashes. 9. A CMT must record a medication administration. Which document is used? A. Patient care plan. B. Medication administration record, MAR. C. Nursing assessment sheet. D. Physician's prescription pad. 10. Which abbreviation indicates a medication should be given twice a day? A. QD. B. BID. C. TID. D. KID. 11. Which of the following is considered a high-alert medication? A. Acetaminophen. B. Insulin. C. Vitamin C. D. Calcium carbonate. 12. A CMT should crush medication only when A. The patient requests it. B. It is scored and approved for crushing. C. It is a time-release capsule. D. It's a coated tablet. 13. If a patient refuses medication, the CMT should A. Force the patient to take it. B. Document refusal and notify supervisor. C. Leave the medication at bedside. D. Hide it in food or drink. 14. Which route of medication administration involves placing the drug under the tongue? A. Oral. B. Sublingual. C. Buccal. D. Intradermal. 15. The term PRN means A. As directed by physician. B. Daily. C. When necessary. D. At bedtime. 16. Which vital signs should be checked before administering digoxin? A. Blood pressure. B. Pulse. C. Temperature. D. Respiratory rate. 17. A CMT notices a patient is drowsy after medication administration. What should be done first? A. Call the physician immediately. B. Document the side effect and inform nurse. C. Skip next dose. D. Give the patient coffee. 18. A CMT is asked to administer a medication not listed on the MAR. What should be done? Give it since the doctor ordered it verbally. B. Refuse and notify supervisor. C. Add it to the MAR after administration. D. Administer and document later. 19. When drawing medication from a multi-dose vial, what must be done first? A. Inject air equal to dose needed. E. Wipe the rubber stopper with alcohol. C. Shake the vial vigorously. D. Store it in room temperature after use. 20. What is the safest method for identifying the correct patient before medication administration? A. Asking patient's roommate. B. Checking wristband and confirming with patient. C. Asking patient to describe their illness. D. Relying on staff recognition. 21. Which is an example of a controlled substance? A. Ibuprofen. B. Morphine. C. Aspirin. D. Multivitamins. 22. A medication error occurs. The first action a CMT should take is A. Report to supervisor immediately. B. Document and ignore if minor. C. Tell the patient not to worry. D. Dispose of evidence. 23. The abbreviation IM means A. Intramucosal. B. Intramuscular. C. Intramedullary. D. Intramembranous. 24. If a patient vomits immediately after taking oral medication, the CMT should A. Administer a second dose immediately. B. Document and notify nurse. C. Ignore and continue routine. D. Give medication later without documentation. 25. Which medication form is designed for slow release over time? A. Enteric-coated tablet. B. Extended release capsule. C. Chewable tablet. D. Sublingual tablet. 26. When should medication reconciliation be performed? A. Only during emergencies. B. At admission, transfer, and discharge. C. Once a week. D. Only when new medications are prescribed. 27. A patient with swallowing difficulty is prescribed oral tablets. What should the CMT do? A. Crush and mix without permission. B. Report to supervising nurse for alternatives. C. Dissolve in juice without checking. D. Skip the dose. 28. A medication labeled topical should be applied. A. On the skin. B. In the ear. C. In the mouth. D. Into the bloodstream. 29. Which of the following is a common side effect of opioid medications? A. Constipation. B. Increased appetite. C. Hypertension. D. Diarrhea. 30. A CMT should wear gloves when administering which type of medication? A. Oral tablet. B. Topical ointment. C. Sublingual tablet. D. Chewable vitamin. 31. The abbreviation QID means A. Once a day. B. Twice a day. C. 3 times a day. D. 4 times a day. 32. A patient asks what their prescribed antibiotic is for. How should the CMT respond? A. Provide simple, truthful explanation within scope. B. Refuse to answer any questions. C. Change the dose if patient looks concerned. D. Tell them to research online. 33. A CMT suspects a patient is hiding medication in their cheek. What is this practice called? A. Pocketing. B. Hoarding. C. Cheeking. D. Storing. 34. The safest position for administering oral medication is ... A. Lying flat on back. B. Sitting upright. C. Side lying. D. Walking around. 35. A patient receiving diuretics should be monitored closely for A. Increased potassium levels. B. Dehydration and electrolyte imbalance. C. Elevated white blood cell count. D. High blood sugar. 36. The abbreviation HS in medication orders means A. With food. B. At bedtime. C. Every hour. D. With water. 37. Which of the following is considered a medication error? A. Giving a dose 1 hour late. B. Skipping a dose with approval. C. Documenting before administration. D. Administering to wrong patient. 38. What is the primary purpose of a medication administration record, MAR? A. Document vital signs. B. Record medication administration details. C. Track nursing schedules. D. Log dietary intake. 39. Which of the following is an enteral route of medication administration? A. Sublingual. B. Intravenous. C. Oral. D. Intramuscular. 40. What is the most important reason to document medication administration immediately after giving it? A. To avoid double dosing. B. To satisfy hospital policy. C. To prevent nurse reprimand. D. To complete paperwork quickly.